I think a cancer journey is hard enough as it is, and actually talking about sex is hard enough as it is, but put those two things together and it's nigh on impossible. So how does cancer affect sex and intimacy? I'm Helen Addis, also known as the Titty Gritty on Instagram, and I'm joined by experts Richard and Sarah. So it's really important, isn't it, that we talk about the physical impacts that cancer has on our sex life, and indeed the practical things that might be available and should be available to us to help. So one of the biggest things that I've read about, vaginal dryness. Haven't just read about it, experienced it. So why is that? Why do we get it?
Well, there are a number of reasons that a person affected by cancer might experience vaginal dryness. Hormonal treatment switch off estrogen, and that in essence causes a postmenopausal state in the vagina. And once the vagina is deprived of estrogen, it thins and it doesn't lubricate naturally. And also the walls of the vagina become thinner, so that penetrative sex might actually be painful. If a person has had pelvic surgery for a cervix cancer or a hysterectomy, the top of their vagina might be shortened, so the depth of penetration might be difficult because the vagina is simply not as long. And people who've had pelvic radiotherapy may experience what we call a late effect, where that radiotherapy over time causes the natural elasticity of the vagina to be lost, and the vagina becomes smaller and tighter. So there are different ways in which the vagina can be affected, and all of those are likely to impact on sexual function.
Are there any reasons why a woman who has had, say for example myself, has had an estrogen receptive cancer couldn't use a lubricant?
Two aspects here. There's the natural wetness that you'd expect in anticipation of sex and during sex, and that's what water-based lube is replacing. The second thing is the natural estrogen state of the vagina. The vagina is an incredibly powerful part of the body. It's a concertina that's powerful enough to expand and pass a baby's head through it.
Don't I know about it?
So, like Richard said, that loss of lubrication is what we're trying to give back in order to enjoy sex a bit more and for penetration to be less uncomfortable. Now, lube comes in 4 different forms. It can either be water-based, oil, petroleum, or silicone. 9 times out of 10, we would advise you to use a water-based gel. The water-based one is much easier to wash off. Things like silicone can be a lot harder to wash off, meaning that you increase your chance of throwing off the pH level in the vagina, which can cause you bacterial vaginosis, things like thrush. Second reason as well is because it has a less chance of a condom break taking place. So this is the Love Honey one, and it's a water-based lubricant. And with lube, a little goes a long way. 1 or 2 drops, and you want to pop them on the vaginal entrance to be specific. If you have a penis, you can also place it on your penis before penetration. But if it does still feel painful, then avoid sexual contacts until you see your doctor.
So the decline in your sex drive after a cancer diagnosis, it's a real issue, isn't it, for many?
It is, and one way to try and reconnect with that is to rediscover sexual pleasure. And you don't necessarily need a partner to do that. We'd encourage them to experiment, to masturbate, to use sex toys to try and find what gives them pleasure.
Never heard somebody actually medically trained say that before. It's interesting, isn't it? Because they're called sex toys and it feels like not serious, but actually they can really make a difference.
Yeah, absolutely. And I'm so glad you spoke about the importance of introducing toys. This is the magic bullet wand, and I think when it comes to sex, we often think of foreplay and masturbation as the starter, and then we think of penetration as the main course. But what we need to remember, and especially if you have a vagina, is that you're more likely to actually experience an orgasm and have more stimulus through foreplay than you are from actual penetration. So this is from Love Honey. This is a targeted sex toy, and it's used to stimulate mostly the clitoris. Not only can you use it to stimulate the clitoris, but you can also use it on the nipples, which are an erogenous zone, as is the neck, as is the inner thighs. The good thing about this as well is that not only is it good for solo play, but it's good for partnered play as well.
The value of this, from my perspective, for the people I see, is being able to reconnect with sexual pleasure.
And speaking of erections, is that an issue after some people have been through a cancer diagnosis, prostate cancer, testicular cancer?
Yeah, absolutely. And then there are very physical impacts, so radiotherapy, and most specifically, perhaps the most common way we see that is in prostate cancer treatments when men are deprived of testosterone by therapies. And there are well-reported medical ways to restore erections, so everyone's heard of Viagra, for example, but there are devices that can help restore.
Now, this is a penis pump. So what it does is it works towards potentially increasing the size and the strength of an erection. So how it works is it's very simple. Put some lube on the penis, insert the penis inside, and inside you feel a textured grip. It encourages the penis and it draws blood to the penis to get an erection. And that just sort of gives you back the confidence to get back into the habits. I think for a lot of men, once you lose the ability to have an erection, a lot of men say it can become emasculating.
Well, the loss of an erection is probably the most obvious. I think the other really important thing to consider is anal function after radiotherapy. A common treatment for prostate cancer is radiation to the prostate, and in the immediate period during that radiotherapy and afterwards, the rectum becomes very inflamed. So many who are having sex with men will find anal intercourse very painful during that period. So we usually advise abstaining for a while, but then afterwards gentle reintroduction, perhaps using a sex toy to begin with, lots of lube, but hopefully being able to go back to pleasurable anal intercourse once the radiotherapy reactions have settled down.
So what other impacts can radiotherapy have?
The other big impact we see on sexual function from radiotherapy is when women have had radiotherapy to the pelvis. Whilst that's a very successful treatment for the cancer, over time it can cause the vagina, the word we use is fibrose. It loses its natural elasticity and it can shorten and it can become smaller. In order to deal with it, you need to use vaginal dilators. So these are NHS vaginal dilators.
So I've never heard of a vaginal dilator.
This is what we give out in the NHS. They come in multiple different sizes because the point and the problem is that the person affected has constricted their vagina, it's very small, and the idea is that you use the smallest applicator available, insert that into the vagina with lube regularly and daily to try and stretch the vagina, and when that becomes more comfortable you move up in sizes. But this is what you get on the NHS, and I think they're better than nothing.
Very similar to the NHS ones in that they come in a variety of diameters. So like Richard said, you normally start with the smallest, working your way up. You're fully in control of the depth that you can go into when you're using them and the control and the positioning. So that's really important. They're also made from silicone, so really safe to use on the body, and with using lube you want to of course again start with the smallest size. Now when you're using them, really important that you feel a pressure when you apply, so you don't want to feel pain. Of course if you feel pain then stop using it, but you want to feel a pressure because you want to feel that your vaginal wall is being expanded. So this is a really good practice.
They feel a lot
to get into the
softer.
habit of using. Yeah.
If a woman's sexual partner is a man and she's concerned about their sexual pleasure, one of the problems with a shortened vagina is the depth of penetration that their male partner might achieve. And dilation takes quite a while to be effective. So one way to achieve sexual pleasure for the male partner and achieve that sense of depth of penetration is these penis bumpers.
You can see they come in 3 different sizes as well.
Oh, rubbery.
So as you can probably
I see.
the idea is that they go on the penis, at the base of the penis, so they give a sense of constriction and pleasure, but they don't allow for deep penetration.
Right, okay. Gosh, who knew that would exist? And what about oral sex? Is there anything we should know about?
I guess the area where oral sex is most impacted is in those people who've had cancer in the head and neck region. Almost all of those cancers are treated usually with a combination of surgery and radiotherapy. One of the most classical side effects of that is actually a dry mouth, and that impacts on the ability to have oral sex successfully. Perhaps a bigger and more obvious impact is the ability to have intimacy just with kissing.
Yeah.
And I reflect on a patient of mine who was very depressed after their cancer treatment, and we thought it was because he was losing weight and because he wasn't enjoying his food and because he wasn't able to eat and drink as well, which are all things that we conventionally talk to our patients about. It was only when he had a good conversation with his Macmillan nurse who she came to and said, actually the problem is he can't kiss his wife.
Oh my God.
And that was the thing that was obsessing him the most. So talking about those with patients, addressing them, helps with oral hydration. So the commonest physical intimacy of kissing, but also with oral sex.
Do you know, I've just remembered actually, I had horrific mouth ulcers when I was going through treatment. I mean, I'd eat and drink through a straw at one point, and I was certainly not doing any kissing. And so, I forgot how much that affected me. So what about how after a mastectomy your sex life can be affected?
It does affect their sex life. in a number of ways. Firstly, because it's a physical impact on their appearance, and that might affect whether they feel like a sexual being, whether they feel attractive. I would say it's not just mastectomies. Any breast surgery might affect the way the breast feels or about the way a woman feels about her breast. Indeed, any surgery. But I think one of the things we don't always talk about is this incredible cosmetic surgery to restore the look of a breast, so a woman might feel like an attractive sexual being, but we're not very good at talking about the way it feels.
I have no feeling from all the way here across my chest on one side. I mean, you could poke me there and I wouldn't know that you were doing it. So I can imagine that it affects a lot of people's sex life. But the nerve, the feeling.
Nerves are the slowest tissue in the body to regenerate. They can regenerate, and very, very slowly. But usually a woman who's had what we call an autologous reconstruction, where tissue has been borrowed from one part of the body and brought to the breast, are not usually going to get sensation in that area.
It's just navigating, like you said earlier, your new normal, and I guess learning to fall back in love with the new normal. Can you have sex with a stoma bag? Of course, I'm assuming you can.
Mm-hmm.
It's absolutely safe. Most stoma users will know how reliable their stoma bag is, how good the adhesive is. They'll know what positions are possible that are not going to threaten that bag, and it's an absolutely safe thing to do.
So I've learned so much from you guys about advice that's available and products that are potentially available, and actually from my point of view, I wish that I'd known about this when I was first diagnosed, so that actually my journey could have been an awful lot easier. But from your point of view as experts, what would be the gold standard in terms of the best care when it comes to sexual health and cancer?
I think now it's being recognised as a part of your general health and well-being, and as an integral part of your general health and well-being, not just sort of a private thing. It's something that is part of your medical care. When you see people like Macmillan and brands like Love Honey who really it's not just about pleasure, it's about the health element, it's about, the mental wellness. It's sort of a general approach. So my wish is that these tools and these health products that we've spoken about today will become more readily available, and it won't be something that is, either too expensive or inaccessible.
I think a cancer journey is hard enough as it is, and actually talking about sex is hard enough as it is, but put those two things together and it's nigh on impossible. So actually you would want the professionals and the products around there just to be accessible to you without there being any embarrassment or
A fear of asking.
A fear of asking.
That's what I would like to see, where this is a part of, a general questionnaire, where as clinicians we take the initiative to ask the patient, understanding that, from different cultures it may not be that easy, no matter how much we speak about, normalising the conversation. For some people it just might not be easy. And even things like training for nurses, for doctors, for health advisors, and not just within the sexual health space where I work, but just as part of general healthcare.
Yeah, and give me that permission for me to be able to ask for help.
Like, I can't speak about this.
I can't speak about this.
It's not embarrassing.
So what would the best care look like?
Well, I think we've started to see an example of that with the Macmillan Love Honey partnership. During that, we've seen people affected by cancer tell their stories openly, without embarrassment, and that sharing has been seen by thousands of people and responded to by thousands of people. And if we can get to a place where people are able to talk without embarrassment about the sexual issues after cancer, and healthcare professionals to ask about it and respond to it in a practical way, then we've done something really important about restoring sexual wellness to a part of a holistic recovery after cancer.
Well, I don't know about you, but I have learned a lot from that today. I'd love to hear your comments or your questions. Put them down underneath this video and make sure you hit the like button.